All right, what'd you say?
So how are you feeling?
I'm feeling good. So I am 72 hours post-op from having a partial nephrectomy done on Tuesday afternoon. It's Friday afternoon about 3:30. I was released from the hospital on Wednesday about lunch. So I was in the hospital for about 30 hours. I did a partial nephrectomy on my left kidney with about a 2 centimeter solid mass is what they call it. After the surgery, very sore. I don't think it really would have inhibited my movements. I think what inhibited my movements was I had a catheter that I had to keep in for 24 hours, I guess. And I don't really like moving around with it. But I do have some video that I might post. It shows me walking down the hallway, dragging that bag with me. But I don't know. We'll see if I can figure out how to edit these videos. Anyway, like I said, pretty sore. After the surgery, it was controlled with medicine, but after a few hours, when it was kind of explained to me that, hey, you can go home if you quit taking the drugs and get up and move around, that was a whole lot of motivation to get out of that hospital. So I got back to the room about 12:30. The last time I took any opioids or hydrocodone or whatever they gave me was about 2 o'clock. Just after that, it was just Zofran and Tylenol until they released me. I got on walk that night about 10 o'clock. I still had the catheter in, which made it kind of uncomfortable for me. The next day, doctors started coming in about 6 o'clock. Urology residents and finally the surgeon. I spoke with all those guys. They came in and removed the catheter. Right after they left, put me on a little bit different of a diet. What was it called? A full clear diet, liquid diet. So at this point, I think they'd already made their mind up they're going to send me home. They pulled the catheter out. I was able to go ahead, and my bladder was doing what it was supposed to do. So that was pretty much it. The doctor came around about 11. I think at 12:30, I was in my truck. My wife was driving me home. So I have nothing but praise for the folks at Barnes Jewish Hospital in St. Louis and Dr. Sam Biani and his team who did the surgery, did all the pre-op, post-op stuff. The folks at the hospital were very great. They were very nice. So, I can't thank those people enough. Today, like I said, 3 days later, I haven't really felt like making a video because I've been pretty sore. I did 5 incisions on my left side here and one larger spot where they were able to pull the tumor out. I'm still waiting on pathology, and it'll probably be back sometime next week, I think is what the doctor said. So we're waiting on that. And like I said, just hadn't really felt like making a video. It's been kind of sore. Didn't want to move around, haul this fancy circle light and this camera around that I've got here and watch my wife laugh at me. So I did it on Friday afternoon, so she was not laughing as much. And if I was to laugh, I would probably hurt because those little incisions suck. But anyway, I got pretty good range of motions. Never got sick. Never felt bad. Have no issues with.
Was immediately hungry.
I was starving as soon as I got back to the room. They let me have some chicken broth, which was the best chicken broth that I had ever eaten in my life that night, about 10 o'clock. So anyway, my wife stayed with me, took care of me. Anyway, like I said, next day, Wednesday, was released. We were on the road by 12:30. It's about a 3-hour drive from St. Louis back to where we live, down in Boot Hill, Missouri. So we got home, got in my chair, laid down, just kind of laid around, did nothing. Slept that night, which I didn't think that I would. Last night, not so much, kind of tossed and turned. But anyway, the soreness is going away. So that's kind of where I'm at right now. Waiting to go back. I go back for a follow-up next Friday back in St. Louis. So we've got to take a 3-hour ride back up to St. Louis again and to the doc. And no stitches to take out. There are 5 exterior little puncture holes that they put in me that they cover with stair strips. Those will fall off on their own. The internal sutures they put will dissolve on their own that they put on the kidney, and whatever else they either cut or burned away during the procedure, which took about how long? How long did the procedure take?
About 2.5.
About 2.5 hours. And I did read one of the reports, I think, where he said he had the artery clamped on my kidney for about 15 minutes, which is pretty quick. But evidently he was able to get in there and do exactly what he needed to do. If you get a chance, if I could do it, I'll link a video of one of his surgeries. He doesn't have anything current, but he does have some stuff from about 8 years ago. But even the robot they're using now is a lot more movement, like a lot more dexterity with the machine itself, so they can do more today. So I'm pretty impressed. So that's that. A little soreness is going away every day. I'm feeling better every day. So, but I know there's still a lot of internal healing that needs to be done. So we'll go check with the doc here in about 10 days or about a week. And I may give you an update before then, but I will try to link some videos into this of a partial nephrectomy using a Davinci XI robot. And we'll see where we go from there. Wish me luck. MIZ.